how it could get into our room from the attic, a little unclear.
It's 1 a.m. in Richmond. You're asleep inside the house you just bought when something touches your leg.
So got out of bed, pulled back the covers, like literally pulled back the covers, and there's like a little squeaky bat, and it's in our bed, which is unpleasant.
Unpleasant was just the start for Dave Goodman and his girlfriend, who trapped and released the small bat before going back to bed. The next day, friends convinced them to seek treatment for rabies because, while rare, the virus is 100% fatal in humans.
Shannon called her primary care physician, and they said, well, we don't have rabies shots here. You got to go to the ER for that.
The couple ultimately went to Bon Secours St. Mary's Hospital, but tried to be savvy, and they asked for a price estimate before treatment. While stating it might not be the final charge, the written estimate led them to believe they'd each be responsible for less than $500.
Apparently what I learned later was that was the cost to walk in the door.
Not included on the estimate, a critical rabies drug they needed, priced at a whopping $17,000 for her and $18,500 for him. We searched the convoluted master charge sheets that hospitals are required to post online and found prices for the same medicine range from $6,000 at VCU to $13,000 at UVA. So why the big difference in cost?
They just list anything that they can bill for, any item or service that they can bill for, and what goes into the charges. It's hard to say.
Dr. John O'Shea, an expert with the Mercatus Center at George Mason University, says the sticker price posted online means very little. What matters most often is the secretly negotiated rate between a patient's insurance company and a provider.
It's been described as trying to go buy a car when all you get is this list of like, well, here's what the carburetor costs, and here's what the steering wheel costs and the tires, and they don't mean anything, those charges.
So we asked Virginia Health Information, what's the average cost of treatment for rabies exposure? We learned that last year, a typical bill for everything from the doctor to the emergency injection and required follow-up shots was $6,438. On average, commercial health insurance companies reimbursed $4,196 for those services, but not in this case. Anthem sent us a statement saying even though the couple was in-network and the claims were processed correctly, each will have to meet their deductible and co-insurance costs. Bottom line, what they thought would cost $500 each will actually total more than $7,000 combined.
I mean, you don't have a choice, right? And that's the problem. They can charge you literally whatever they want because you don't really have any recourse. What are you going to do?
We reached out to Bon Secours about this. They did not comment on why their pricing is higher or why the initial estimate did not include the cost of the vaccines. Bon Secours sent us a statement that says, quote, in part, we have a duty to make informed decisions based on what's best for the patient, regardless of the potential costs that might be incurred to deliver life-saving care every day. To read the hospital's full statement and comments from the vaccine's manufacturer, visit our website, WTVR.com. Working for you, Bree Season, CBS 6 News.